right now. Professor Sir Chris Whitty, remember him? Well, yeah, he's back in government now, folks. But he, of course, was the chief medical officer, stood there at the podium again and again, telling us all to, stay home, protect the NHS, all of that. But he's currently appearing before the COVID inquiry, where he's going to be questioned about his stay-at-home messaging during the pandemic. Well, let's talk about this and a few other topics as well with Carl Hennigan, Professor of Evidence-Based Medicine at the University of Oxford. Good morning to you, Carl.
Good morning, Julia.
Always good to be joined by you. Thank you very much indeed. I want to talk to you a little bit about Keir Starmer in a few moments as well. Yep. But Sir Chris Whitty is facing questions basically about the impact of the crisis on NHS workers, patients and delivery of healthcare. And this module is looking at the government and societal response to COVID-19, particularly looking at the messaging about people staying at home. Protect, is it? Remember that message? Grilled into our hearts, isn't it? Stay home, protect the NHS, save lives. People did stay home because we were legally required to. Did it protect the NHS and did it save lives?
Well, first thing I wanted to say to Julia is this is module 3 and it's day 12. It's due to go on for 41 days and there are 10 planned modules. So we're going to be speaking, if you want to keep speaking to me on the inquiry, for 4 or 5 years, much longer than the actual pandemic itself. So we ain't going anywhere soon. Second thing is, you're right. That messaging should be really problematic. Protect the NHS. I think that was the single worst slogan. But the key question here is, everybody's sort of defending all of their decisions. But the key question is, was the NHS able to cope? Well, the answer is in that first wave, no. And if so, how many deaths were responsible from the panic, the fear that ensued and the inability to organise services right across the board? Primary care shut down. Hospitals were in a state of, I say, limbo until they started to get their act together, and there was huge mortality. Let's be clear, in the first wave. But how much of it was a response of the fear and the panic in the system? And how much, I think this is an important issue as we go into winter. How much is it because we actually run a service for which actually the number of available beds is very small, and every winter, if it gets cold, this winter could be one of those where we're back to the NHS winter crisis because we just do not have enough available capacity and people with experience to be able to understand how to manage things when they start to go badly wrong.
Yeah, indeed. We've had a winter crisis every year since I've been an adult. Now we've had summer crises as well. You, of course, work. You're not just an academic professor. You also work in A&E at a hospital. Every weekend. You know the reality of it. The thing is, we were told the NHS couldn't cope. But the initial line about us locking down was for 3 weeks, and it was to flatten the curve. Remember the sombrero? And so basically the idea was that we didn't have loads of people getting sick at the same time because the NHS couldn't cope. Meanwhile, we were going to build these Nightingale hospitals. Well, they built these Nightingale hospitals. It was a fantastic effort. Military playing a huge role in that. They were barely used. Literally, I think, 100 people or 200 people were ever in them. They weren't needed because, of course, the demand on the NHS effectively disappeared because everyone was told, stay at home because your job now is to protect the NHS so it's available for people with COVID. It doesn't matter if you've got cancer or you've any other problem. Don't worry about that. You're not going to be treated for it. So you're just going to stay home. The reality is we now know that, flattening the curve is all very well. There's an argument for that to prepare, but keeping us in lockdown doesn't actually save lives. It actually has massive harms. We're seeing that play out not just in the economy, in education, mental health particularly, but physical health right now. The extra demand on the NHS right now, a lot of it is being driven by people who just did not get proper health care for a crucial year or two of the pandemic. But do you think we'll get any real honesty from people like Professor Sir Chris Whitty? Because he and Patrick Vallance and us, they were crucial in the messaging that we got. And we kind of were of the view, a lot of us, that, well, we might not trust Boris Johnson and everything, but if his chief medical officer and if his chief scientific advisor are standing by his side and they are saying do X, do Y, if they're supporting the government policy, it must be based on evidence, it must be based on science, it must be based on medicine. But a lot of it wasn't, was it?
Yeah, the Centre for Mental Health came out with a report that said we're suffering a collective trauma based on the effects of isolation, bereavement and fear. All of those three were put into place for about 12 to 18 months. Unfortunately, what's happening is nobody's actually coming out and sort of telling us that in this situation, here was the huge uncertainties, here's the decisions I made, which I didn't think about the consequences and the collateral damage, and therefore in the light of day, they need to be examined.
Yeah.
And what's happening is Chris Whitty's just took the stand and he's doubling down on lockdowns were the only answer.
Yeah.
But the KC should come in then and say, well, hold on a minute, what about Sweden then?
Yeah.
Because what you're telling us, the data in Sweden should give us this ability to look at this as a control group and say a disaster happened. But on all the measures, in the light of day and the round, actually, they're better for all of those measures. Apart from probably the care homes in the wave one, which was where the real problem is and still exists. So why are we not getting this incisive, as opposed to people being allowed to say, what we should do is more of the same next time. And in addition, we should be prepared more, which is going to cost us more money in the round, and actually prepared for what? What have we learned? I'm not sure we're going to learn anything.
That's my big worry. It still blows my mind how many people, including people who should know better, who can read the evidence, including politicians, but how many people, just ordinary people, who genuinely believe that the lockdown saved lives overall, that they actually believed it was the right policy, that masks work. I thought I'd get the tube home every day. The number of people wearing masks, I mean, it's just astounding. It doesn't matter how much evidence is presented, people are going to stick to this. And there are so many people who want to cover their backs because their entire sort of future, you know, their knighthoods and things rely on them covering their backs, and it's in everyone's interest because you haven't got a new government coming in who are going to question what the old government did. This new government, Keir Starmer was busy supporting, not even just supporting COVID measures, he was calling for more COVID measures, even when he was, turns out, sitting not in his own home working from home, but sitting in Lord Ali's penthouse home, £18 million worth, when he delivered a message to us in December 2021 when the Omicron variant had appeared and people spent a second miserable Christmas without their families, telling everyone to work from home. He wasn't even in his own home then.
So I think, you know, one of the things that really ires people is the disconnect between the politicians and the people in power and what they say and what they actually do. It started with Dominic Cummings and Neil Ferguson. Huge amount of people were breaking the rules at any one point. And there you are in December 13, 2021, where the messaging is work at home from all costs. Because we're going to go into the modelers are saying another disaster wave. Perfect point for a politician to say, I'm sticking to the messaging. Now, what they have to explain is this position where there's a complete disconnect between what I say and what I do.
And that's what we said, and that's where we were with Partygate, weren't we? With Boris Johnson again. Why didn't they obey the rules? Because they knew the rules wouldn't save lives. That's the key message. Cal Hennigan, always good to talk to you. I feel we will be talking to you about this for many years to come. Thank you very much indeed for joining us.